is a Fox 5 News special report.
Good Monday afternoon, everyone. I'm Maria Arcega-Dunn. This is a Fox 5 News special report. Governor Gavin Newsom is providing his daily update on California's response to the coronavirus pandemic. It is now just underway, so let's listen in live.
To our stay-at-home order. Let me contextualize as I stand here today where we are in this state as it relates to the broader trend lines, and then begin to unpack where I believe we will be going over the course of the next week, two, and then, of course, over the course of many, many months ahead until we have immunity, until we have a vaccine. We have 24 counties currently in the state of California that have self-attested, certified with containment plans, with protection plans that we have put online as regional variants to the statewide stay-at-home order. 24 counties have self-attested. We announced the self-attestation process on May 7th. Many counties began the process of organizing, and we saw a first number of counties, Butte County and others in Northern California, begin that process with the concurrence and the technical assistance and counsel of our state health directors. They were able to self-attest on the basis of a number of factors that were unique to their county and their region. It was a recognition in California that's larger in population than 21 states combined, that one size does not fit all. None of us naive about that. We recognize the conditions across the state are unique and distinctive depending where you are across the state. And as a consequence, the modifications that we made statewide, we allowed for further modification into what we refer to as stage 2 in these 24 counties. We have been working very collaboratively and very closely with their health directors, and we have put those self-attestations up online at our covid19.ca.gov website, and we have allowed through technology, mapping technology, the simple ability for you and others not only living in the community but even outside the committee to check in to see how those counties are doing against their commitments, against their self-certification in terms of their capacity to test, to trace, to track, to isolate, to provide protection for the most vulnerable in their community, be it skilled nursing facilities, other congregate facilities, their capacity to deal with hospital surge and the like. Today, we want to update you not only on that progress, but also update you on the conversations we've been having with other counties throughout the state of California and their health leaders. We've been tracking over the course of the last 14 days by seeing a decline in hospitalizations by 7.5% decline over a 14-day period in hospitalization statewide. We have seen an 8.7% decline in the number of ICU patients over a 14-day period. The last few weeks, we've also seen an unprecedented number of masks be distributed, PPE, throughout the state of California. Tens of millions of masks now we've been able to distribute just in the last number of weeks since we've now moved into this next phase, phase 2 of our stay-at-home order. All of these things matter. The PPE is foundational to furthering our efforts to make meaningful modifications to the stay-at-home order. We were able, I mentioned this last Friday, to distribute some 11 million masks just on Friday to critical sectors of our economy, our farm workers, our grocery stores, to in-home support service workers, folks that are on the front lines across the spectrum, including child care workers and the Department of Education. More and more masks come in. In fact, the inventory this morning was 56.1 million masks that we now have in our possession. We were able to distribute some 46.1 million of those procedure masks. This is in addition to the 45.5 million N95 masks that we've been able to distribute. It's a long way of saying this. The PPE is coming in, and it's coming in, and it's going out. as quickly as we can get it out. And it's going out into critical sectors of our economy. So as we move to modify our stay-at-home order, having appropriate levels of PPE is foundational in terms of advancing that cause. We also are significantly advancing the cause of increasing our testing capacity in the state of California. 1.3 million tests have been conducted to date in the state of California. 57,000 tests just in the last 24 hours were conducted in the state. We're making real progress on our testing as well. Accordingly, we said it's foundational in order to advance more meaningful modifications that we get a workforce together on tracing in this state. As you may recall, those of you followed along some of these announcements, we have a very sophisticated tracing corps that is well established in the state of California. In every county in this state, going back decades, we have health departments that have professional trained tracers and trackers that deal with infectious disease spread, from HIV and AIDS to measles, TB, and the like. It was referenced just a few weeks ago that 23 counties actively had been participating in tracing COVID-19. We had a workforce of a little over 2,800 that were already trained at the local level, a robust workforce in that space. We now have been able to train an additional 500 through our partnership with UCSF and UCLA, and that cohort is being distributed in real time. Many are already in counties that have been trained through this partnership with the UCs. But that cohort now is being replaced with an additional 300 that are entering into that training. So we're seeing that increase in terms of the capacity to have more tracers and trackers. We're seeing that happen in real time, and we're seeing the spread of that capacity in a very meaningful way. We are also looking to identify hundreds and hundreds of others in that training capacity, as well as ultimately meeting that 10,000 goal in terms of the total numbers that we'll be advancing in the very near term. So testing is improving, tracing, we are training and deploying our tracers. We're getting PPE up, and we're getting it out, and we are seeing a significant, steady rate of decline over a long period of time in the number of people hospitalized and in our ICUs. All of those very good trend lines. Thus, the reason we're here today, not just to talk about the past and those 24 counties that have self-attested, but to talk about additional counties that we believe are in a position with more prescriptive framework and guidelines to go into phase 2 even farther. So today we want folks to know that in our additional modifications, we are moving forward to allow some of the larger counties to continue to make progress deeper into phase 2, and to do so effective immediately, but on their own pace. And I say effective immediately, meaning the guidelines are out there, meaning the processes are in place, but they can go at their own pace. We estimate roughly, plus or minus, again, it's a dynamic number, roughly 53 of the 58 counties would be eligible to move into this phase. Again, not everyone will move into this phase, and that eligibility is conditioned on the criteria that we're putting out. And you'll hear from Dr. Ghaly in a moment. He'll talk more specifically about that criteria. The criteria, though, is foundational in this respect, that we're really starting to focus in on the hot spots within counties, particularly in and around our skilled nursing facilities and those areas within the counties that remain the most vulnerable and challenging in terms of protecting people and protecting the spread of this virus. So we, in this next phase, are looking to redouble the efforts around those hotspots within those counties. As well, we are looking to advance some guidelines related to total hospitalizations, no greater than 5% increase over a 7-day period, and make sure that the tracing capacity is adequate to meet at least needs of 15 tracers per 100,000 population. Continue to make sure that the positivity rate, and this is a rate that I've brought up on a few occasions in the past, tracks at less than 8%. And what I mean, if you haven't been following the reference to positivity rates, that's the simple percentage of people we're testing that are tested positive. So as an example, yesterday we were able to test over 57,000 individuals. There were 1,591 positive tests. So you have the denominator, the 57 plus 1,000, and then you have the number of tests. You come up with a positivity rate. And that's the rate that we are tracking more and more closely. As the testing significantly increases, the positivity rate becomes more important than the total number of positives in many respects. And so that rate is now spelled out in the attestations as we move forward as a rate that we are tracking very, very closely. And again, we want to see that rate below 8%. And we want to make sure people are testing, because there was some, well, won't get into too many details, but it's not just the total tests, because a lot of counties may pull back on the testing because they don't want to see positives. Again, it's the rate of positives that is really the focus from our health perspective. So that's the framework today, encouraging progress as we move forward deeper into phase 2 in the state. And I should just note that we are also looking forward in the next few weeks at a number of significant milestones that are worthy of highlighting. We expect, if we hold the rate of transmissions, we hold the positivity rate down, we continue to do justice to the hospitalization and the ICU numbers, that we'll be making announcements statewide, not just with the regional variances, that would allow for retail not just to be picked up, but in-store retail to be loosened up. In addition to that, sporting events, pro sports, in that first week or so of June without spectators and modifications and very prescriptive conditions also can begin to move forward. And a number of other sectors of our economy will open up again if we hold these trend lines in the next number of weeks. And that includes, for example, getting a haircut, which is very meaningful. And that can be done on a regional variance, but it will be able to be advanced, we believe, in the next few weeks, even statewide. And so I want to just go back to that, because I know it's an important one, the hair issues for some, and getting a haircut. The regional variances that we're announcing today will allow for modifications in that space. Statewide, we see if these trend lines hold within a couple weeks to broaden with meaningful modification that particular guideline and order statewide. So I continue down this path, but I'm sitting here just 7 feet away from our doctor, Dr. Ghaly, who's been working overtime with the regions on all of these guidelines and these modifications. And I'd be remiss if I didn't ask him to the mic where he can talk more specifically about where we are and where we're going into this next stage.
Thank you, Governor. It's a pleasure to be here today to discuss the change to our county variants that the governor began to outline for us. I want to begin by thanking all of the people, not just at the state level, but across the state, local governments, public health officers throughout the state, health directors, board members of boards of supervisors, who really came together over the past many days to listen and give feedback on the criteria that the state is announcing today. Just a deep thanks to all the state employees who have made this possible and have worked overtime to get the details right. So as the governor said, today's criteria that we're announcing for eligibility to attest for a county variance, and that is to move through stage 2 at a pace that is faster than where the state is, focus on 3 distinct things. First, the data on the one hand. So those 2 data points are hospitalizations, looking at no greater than 5% increase in hospitalizations over the past 7 days on average. And for some counties that have very few hospitalizations already, we're looking at no more than 20 people hospitalized with COVID-19 throughout your county in any one of the last 14 days. And that's to account for the fact that some counties have very few hospitalizations, and even the addition of 1 or 2 people hospitalized with COVID-19 would represent a quite large percentage increase. So it's meeting that first metric around hospitalizations. The second one is looking at having no more than 25 individuals diagnosed with COVID-19 per 100,000 residents in your county over the past 14 days. It is that one, or, as the governor mentioned, our test positivity rate of less than 8%. And I'm glad the governor went through some description of that test positivity rate, because it is what we are more and more focused on as testing increases. We want to look not just that you have a few number of absolute cases, but that your average number of people who test positive, as you do 100 tests, for example, having fewer than 8 positives means both that we understand the transmission of COVID-19 in your community, but that we also have an understanding of the level of testing that is happening in the community as well. So together, meeting the hospitalization metric of no more than 5% increase on average in the last 7 days, and one of the other 2, the 25 per 100,000 in the past 14 days of cases, or the less than 8% test positivity. So that is on the data and showing that counties are both doing what it takes to demonstrate on the testing side stability, as well as stable hospitalization numbers. On the preparedness side, we are asking counties to be able to attest to a number of things. Many of the things remain, many of those items are the same as in the announcement on May 7th, where counties had to attest to having testing capacity of at least 1.5 tests per 1,000 people per day, or having 15 individuals in their county trained and doing contact tracing per 100,000 residents in their county. This second opportunity to meet criteria for a county variance are requiring that counties begin to work closer with the skilled nursing facilities in their county. So not only making weekly communication with each of those facilities, but bringing them together, elevating best practices on not just protecting residents, but also protecting the workforce in the facilities, and having strategies to address challenges like staffing shortages or PPE shortages in those facilities. So working with not just the state leadership, but also the county leadership to partner with our skilled nursing facilities to work and protect a very vulnerable population in our state. Additionally, we are asking counties to attest that they have ability to protect their essential workforce. We know that protecting our grocery store workers, those who work on public transportation, and many, many others, including those in the health field, need to have the protection in terms of protective equipment and testing, and requiring that counties can demonstrate the ability to work with all of those partners on protecting essential workers is very, very important. In addition, we are asking counties to work with their local hospital coalitions or hospitals themselves to demonstrate the ability to maintain a surge capacity adequate to respond to the needs of potentially a growing number of individuals who need care for COVID-19. That requirement, we did a great job over the last many weeks and months building up our surge capacity across the state. Now we need to make sure that that's maintained as counties begin to increase the number of sectors open throughout their county. The last element of these criteria that is very essential is that we work and have counties demonstrate the ability to pull back if they need to. If we see a sudden number of surge in the hospitalizations or a number of increase in cases throughout a county, we want to make sure that the counties have thoughtful plans to be able to potentially reinstitute parts of the stay-at-home orders that we are loosening or relaxing today, and be prepared to meet the needs of the residents in their counties to make sure that we can serve their clinical needs as quickly and adequately as possible, and that if we need to reduce movement within a county for a period of time to reduce the number of cases that we're seeing, that we have the strategies and ability to do that. So as the state, we are certainly looking forward to working with our county partners to make sure that this can be done as safe as possible, and especially as we move into additional sectors being available with the guidelines posted from the state to open up. We also want to make sure that we are continuing to receive data on a very regular basis, and on our state COVID-19 website, we will have links to county-specific data that shows how each county is doing as it relates to cases and hospitalizations and testing numbers, so that we can keep you informed on your local conditions and conditions throughout the state. So we continue to move forward as a state on the one hand, but recognizing that the state is a very big state, that different regions of the state have experienced COVID-19 in different ways. Different counties have prepared differently over time, and acknowledging that county leaders and county health officers have a very strong and historical responsibility for guiding their counties. And with the support of the state, we are confident that we can begin to do this in a safe and modulated way, that we can come back to you in the next many weeks with additional sectors and the guidelines for those sectors to open back up. And all the meanwhile watching closely the data, so if we have to make any other changes to reinstate some of those stay-at-home orders or other modifications, that we will be able to do that in strong partnership with our local partners and local leaders. So with that, I'll turn it back to the governor.
Thank you, Doctor. Bottom line is people can go at their own pace, and we are empowering our local health directors and county officials that understand their local communities and conditions better than any of us. At the same time, we need to hold all of ourselves to account, transparency, real accountability in terms of the application and the implementation of these rules and regulations. We've been saying this now for many, many weeks. This is a dynamic period that we're in. It's an iterative period. It's not an ideological one, meaning we are not locked in to presuppose anything. We are open argument, we're interested in evidence, and we are engaged in two-way conversations all up and down the state.